So we're going to switch gears a little bit for this presentation and talk about some of the way that some of these legalization bills that have been introduced, the Senate bill that passed recently this summer, as well as the House bill that Mark was mentioning, HR 15, and how they deal with programs that are important, safety net programs that are important especially for the aging population, the healthcare programs and Social Security earnings and nutrition assistance. You can advance the slide here. I'm not going to go through all of these, but before we get into this, I do want to mention that these issues, these priorities of the aging community have not been at the forefront of general immigration advocates, the mainstream immigration advocates' minds as we've been supporting the immigration reform bills. And I think it's partly because of political issues that it's harder to talk about aging immigrants and older immigrants need access to health care and need access to benefits, and they need access to the safety net because of the costs associated with that population. And also, it's just easier, with all there have been focus groups and polling, and the children are much more sympathetic population to talk about needing access to healthcare than other populations. And I think there's also this assumption in this country that the safety net is there for people who get older, that Medicare is there, that Social Security is there, that if you've been here, if you're living here, once you turn 65, you're taken care of, and so we don't have to worry about people who are older, and that's just an assumption in this country in general. And of course, for the immigrant population, I tried to turn that off. It wasn't back feedback. The immigrant population also, from most people's point of view, the immigrant population is a younger population, so I think it also is less at the forefront of people's minds, and people aren't thinking about that population getting older. But of course, the longer that people stay here and the longer that they're undocumented, it becomes more and more important that we fix the immigration system, because people are going to get older, people are getting older, and they will need access to these programs that if they're undocumented, they are completely shut out of. And if they're not able to work with authorization, they also can't pay into the system, they can't pay into Social Security, they can't pay into Medicare. And so if the longer we wait on immigration reform, the less of a chance that folks who have been here for decades and who are working but may not be working on the books and may not be paying into these systems will be able to get those programs that most of the population just takes for granted. So this slide, I want folks to remember all of the barriers that are there for people accessing these programs when they have legal status. So what we'll focus on today are the legal barriers, this first bullet. When I put this together, I didn't realize the room would be so deep, and so the PowerPoint's not going to be so super helpful for all of you. But so we'll focus on the legal barriers, and those are really the restrictions on eligibility to these programs, which immigrants are eligible and which immigrants are left out. But also important to remember that there's a whole host of barriers that are specific to the immigrant population. That confusion about eligibility rules, because it is so complex for people who have different immigration statuses. Public charge concerns. Will using programs affect someone's immigration status, their ability to get their green card, their ability to naturalize? Sponsor deeming and liability issues. Especially important for the older community is people are sponsoring their parents to come over and want to know, what liability do they have if their parent needs health care or needs some of the other benefits. Verification concerns, confidentiality and reporting concerns. If someone's undocumented and they go to a hospital, how do they know that their information will be secure and it won't be shared with ICE or with immigration enforcement officials? These keep people away. Language and cultural barriers, of course. Immigration enforcement I mentioned. I do want to mention that recently in the last couple of weeks, ICE, the enforcement arm of Department of Homeland Security, did issue a memo clarifying that in terms of the Affordable Care Act and applying for health insurance in the Affordable Care Act, that information that's put on applications for health insurance will not be shared with immigration enforcement and won't result in any civil immigration enforcement actions against people or against their family members who are applying for the Affordable Care Act. So I think that's important to mention. And then residency and other program requirements. We can go on. So luckily Mark went through these already, but these are the key provisions in the Senate bill and the House bill that is very similar. These different statuses that were created, so most of the undocumented population right now may be eligible for this Registered Provisional Immigrant Status, or RPI status, which has a 10-year path to a green card. So if people are eligible for this, they would be able to get work authorization, have all these other requirements that they have to meet, and then after 10 years would be eligible to apply for a green card. And so at the very shortest path to citizenship is 13 years under the bill that passed in the Senate. Dreamers would fall into this category, but they would have a shorter path to a green card and citizenship. So after 5 years, they'd be eligible for a green card and could simultaneously apply for citizenship. I mentioned the blue card, the agricultural workers, which has the shorter 5-year path to a green card. The shortest path to citizenship for ag workers would be 8 years. These V visas, this is the visa for folks who are in the backlog and may not be in the US right now, but this visa would allow them to come and be with their families while they're waiting for their priority dates to get their green cards. And so the path to a green card here will vary based on that person's circumstances. And then the future workers, the W visas. So how do these different people have access to the healthcare programs? You can advance. You can advance to the next one. This is just a visual of the road to citizenship for the registered provisional immigrants. That the fines, the renewal that has to happen, the fees. We don't know what all of the fees will be like because the fees have not yet been determined for the RPI application. And so at the very least, we know it'll cost $3,750 to get through this process, but that's not even knowing what the fees are going to be for the applications. And 13 years to citizenship. All right, so this is the part that'll be hard to see from the back. These are some of the major public benefit programs, the federal means-tested public benefit programs. So this first row is Medicaid, CHIP, the Children's Health Insurance Program, and SNAP, or food stamps. And over here we've got the different categories of immigrants. So the first column with all the green check marks are refugees and asylees and other humanitarian immigrants. The next 3 columns are the green card holders. So we've got green card adults in the second column, LPR kids, and then LPR pregnant women. And then other lawfully present immigrants, because green card holders are one subset of a couple dozen other categories of lawfully present immigrants, like people with temporary protected status or deferred action, or the non-immigrant visa holders. So those would be those folks. And I say except for DACA, because individuals granted deferred action through the Deferred Action for Childhood Arrivals program, which was the administration's program that was announced last summer that allowed people, the Dreamers, to get work authorization and temporary legal status. Even though those folks are lawfully present under immigration laws, they are actually treated differently. They're treated more like undocumented immigrants in terms of access to healthcare programs, including the Affordable Care Act, which will be on the next slide. So we have them with the undocumented immigrants, even though they're lawfully present. And then this last column are the categories of folks who are in the immigration bills, in the Senate bill and in the House HR 15. And so the registered provisional immigrants, the blue cards, and the V visa holders. And these folks were, you can see with the categories we have now, how complex it is for people unless they are in one of the humanitarian categories or are a refugee. That there is a 5-year bar for the public benefit programs for other people who are green card holders. That in general, lawfully present immigrants, if they're not a green card holder, they're not eligible for public benefit programs unless they're a child or pregnant women, and unless they live in about half the states that have decided to cover those folks, those children and pregnant women. Undocumented immigrants are, for the most part, completely left out unless they have an emergency. And then you'll see that the immigration bills treat these people who gain legal status as if they're undocumented immigrants for purposes of the public benefit programs. So for the entire 10 years that people are waiting to be eligible for a green card, they're shut out of public benefit programs. Even though they're required to pay taxes, they're paying into these programs, they are excluded, and the law specifically excludes them from these programs for the whole time that they're in provisional status. So these are more of the healthcare programs, sorry, cut off at the bottom. So we've got Medicare here on the Medicare premium free Medicare. So this is the Medicare that if you've contributed 40 qualifying work quarters, so basically 10 years of full-time work, when you turn 65, you're eligible for Medicare for the premium free side. And then the premium buy-in to Medicare, and then the Affordable Care Act. So you can see, there was complexity in the public benefit programs. We made some gains with the Affordable Care Act. We got rid of some of these 5-year bars. We stopped differentiating between different people who were here legally, and we said if you're here lawfully present, you're eligible to buy health insurance under the Affordable Care Act, and you're eligible for subsidies. But then for the folks who gain legal status in the law, under the immigration laws, we said, all right, you can buy full price health insurance in the exchanges. We'll give you that, which I think for most low-income people is going to be pretty meaningless. But you're still excluded from the subsidies for the entire time that you're in provisional status. Medicare is a little bit complicated. There is no mention of Medicare in the immigration bills, partly because I think they're assuming that they won't have to. The immigration bills are really concerned about the 10-year budget window that Congressional Budget Office looks at. And for the most part, you don't have to look at Medicare yet for this population who are undocumented. So there's no mention of that. And Medicare does have immigration-related restrictions. So first you have to meet the work requirements to be eligible for Medicare, and then you have to be either a green card holder or lawfully present, depending on which program here. So the main point here is that it's super complicated already for these programs, and immigration reform, we were told during the Affordable Care Act debate that we had to exclude undocumented immigrants from the Affordable Care Act. But don't worry, we were told, we'll fix this with immigration reform, because once everyone gets legal status, then they'll be eligible, and that's how we're going to fix this exclusion from the Affordable Care Act. And you can see that immigration reform just kind of perpetuates these gaps and extends them for another at least 10 years. That even when people gain legal status, they're still cut out and excluded from all these programs. And this is something that actually was part of the immigration bills from day one. And it was something that Democrats felt like they had to concede on in order to get any kind of Republican support on an immigration bill. And so we had to really defend against further cuts throughout the whole immigration reform process, at least on the Senate side. So it's a big challenge when this is your starting point, when the starting point is people are excluded even after they gain legal status. I think that, and then I do want to mention Social Security, because there was an important change to the Senate bill right before it passed. So after the Senate bill passed out of committee, the Senate Judiciary Committee, Social Security was not touched at all. And so under the current system in Social Security, that if you work, the rule is if you work and you're paying into the system, your retirement account is credited with your earnings. And under current law, workers who are lawfully present in the U.S. can be credited for their full history of work and contributions to the Social Security system. So even if someone is working off the books or working and they're undocumented, once they get a Social Security number, if they're able to legalize, they're able to go back to Social Security, and if they can prove that they've been paying into the system, they can get credit for that work, and it can count towards their Social Security earnings when they retire. But what the Senate bill did at the last moment, in a last amendment that was passed in order to gain a few more Republican votes, they actually changed current law and said for the folks who gain legal status under the Senate bill, they're no longer going to be allowed to go back and get any credit for the work they had while they were unauthorized for up to 10 years of work that they did when they were unauthorized. So this means that that's 10 years of work that they're not going to get credit for, and not going to get credit for the work that they've contributed to Social Security, which lowers their Social Security earnings when they retire substantially. And this was passed in the Senate bill. This part was actually not part of the House bill so far. The Democratic House bill, the HR 15. This piece was left out, but it's a really important part for people who are concerned about the older community. And I think that's where I'm ending.